All right, here now is Marc Siegel. He is Fox News medical correspondent and professor of medicine at NYU Langone Medical Center. They did a great job of setting up the problem for us. So it's you're buying insurance, you're in agony because the price is high, but it feels like you don't have it because it doesn't cover anything. So let's fix it. You were telling me that the problem is there are different things within it that are going to take different amounts of time to fix. One of them is the idea that you need to be able to buy insurance across state lines in order to create these pools. Because
antitrust legislation prevents that right now. States have to manage their own insurance. So that law has to be changed from 1945. That has to be repealed. So that's going to take a while. Then you could set up a national exchange, which would work better than the state exchanges. And by the way, one of the reasons we're in this mess, and it was in the setup from James in there, is that it's not that Obamacare is falling apart as we look at it. I mean, the premiums are soaring, and you go to the doctor's office, and you and I were discussing this. You go to the doctor's office, and I can't refer you to the doctors I need to give you care. So there's no access.
Because no one takes it. So you go about fixing that. One of the things that you say they could do quickly is remove the mandate.
The mandate's ridiculous because you're being mandated. Only 30% of patients that take it are young. In other words, 30% of the people who buy Obamacare are young. You know why? Because young people are like, I'm buying this thing with high premiums. I don't need any of these essential benefits.
So that's good relief for those people, but at the same time,
get rid of the mandate.
Get rid of the mandate. We want to allow people to buy catastrophic insurance for only when you want something very big. That would help.
That would take about 5 minutes, by the way. If you're going to keep the state exchanges for now, why can't someone go to the state exchange and buy a cheap policy with a low deductible that they use if they get really sick?
Here's the big problem that's hard to solve, though. We want to keep on the people that have pre-existing conditions and let them still go out and buy health insurance, but they're expensive. I mean, because they're going to, if they have a pre-existing condition, by definition, they're using a lot of health care. How do you pay for that?
So, Melissa, that's where I think government subsidies should actually come in. Not subsidizing everybody at the exchange level where you pay $350 for a premium and $250 comes out of the taxpayer pocket. That's the current situation. But those high-risk pools that I'm talking about on the statewide level for those with pre-existing conditions, those take time to make. So that's why President Trump may be right in setting a timetable a little bit later on for things like high-risk pools, revamping Medicaid so that it's based on block grants to the states. States build efficiency models with teams like are working in Indiana already. Get some malpractice reform in there. Get the insurance across state lines and build health savings accounts. That's going to take time. I think a year or so may be legitimate for that. But in the meantime, let's get the catastrophic insurance in there. Let's get rid of the individual mandate. And most of all, let's get rid of this essential benefits package. That's what makes the premium so high. You have to have this. You have to have that.
That got us going down the wrong road in the first place. That was a big mistake out of the gate. Dr. Siegel, thank you for that. Good
job. Thanks, Melissa.